Hi, everyone, and welcome to our practitioner call. Today is Thursday, January 19th. It's 9 o'clock Pacific, and we are so happy to have you. My favorite call of the week. This call is special because it's practitioners talking about the tools in the box to help their patients. This call is a little different than other calls in that it's practitioners talking about the technology. And it's also, we do a bit of a round robin with practitioners talking about how the technology is working on their patients, and even some patients themselves come on and talk. Many Thursdays, we are blessed with Dr. Patty DiBlasio. I think I'm pronouncing that right, DiBlasio. And
Yes.
she is an MD, an integrative doctor out of San Clemente, California. And she is very familiar with stem cell, with light, with GHK, because she has done that all in her clinic, her practice. And so when she is a guest on these calls, it's very always a lot of great information. Dr. Patty always does a deep dive on the technology. Last week, and that is recorded in Be Activating Practitioner Call on startx39biz.com under tab number 5, Join Telegram. Actually, under the 14 Steps of Success, tab number 5, Join Telegram, and you can see that recording from last week. And she did a deep dive on Nirvana, the patch that makes you happy. This week, we will be talking, of course, about our stem cell technology, the X39, and she's doing a deep dive on our glutathione technology. So that's going to be exciting today. So we always like that. So and then the last 15 minutes, I always do how to set up the offices so you can get the technology to your patients. And Dr. Patty, about 6 months ago when she started, said, Marci, I need to know what to do so I can ship product to all my patients. And can we work on an office setup, a doctor office setup for myself? I said, absolutely. And so we created that for Dr. Patty, and that's what we will share for you. So you can print out the sheets and have the tools for your office as well. So hopefully that will be of service. And you may also be someone on this call that has some doctors in your organization. And so you can bring the information back to them and get their offices set up. So that's what this call is all about. Dr. Patty, why don't you unmute yourself and tell us a little bit about who you are, what kind of practice you have, and we'll just start with that.
Okay, well, it's good to see everybody today, and welcome to this time. I love to share with you just sort of my personal experiences, and I'm not giving any medical advice or treatments. Those are always the disclaimers that we have to put out up front. I'm just sharing my personal testimony, which is pretty awesome, along with some of my patients that I share sort of independently from time to time, and family members. But I'm an MD, a medical doctor. I went to medical school as a second career. And one of my favorite things to share that I may not have shared with this group is that both my son and daughter are physicians, and they were ahead of me actually in medical school. So my daughter was 2 years ahead of me in medical school, and she and I had a very special time together when I was a fourth-year medical student and she was a second-year OB-GYN. And we worked on night float together, and she let me deliver 30 babies. And so that's my special thing. My son is an interventional cardiologist, and he was my supervising physician when I was an intern, and he was a cardiology fellow. So I think they inspired me to do something I'd always wanted to do, but thought it was too late. I was a music teacher for the first part of my life. And so when I went to medical school, I did that just so that I could sort of get all the learning and credentials, but I wanted to continue to do what I'd been doing sort of just as a layperson. And that was looking at all the different alternative and preventive forms of medicine. And so you don't really learn that in medical school, but at least I have those tools. And then I do functional regenerative medicine. I do it both at a clinic here in San Clemente, California, and then also I work with many other clinics around the United States and do quite a bit of remote work too. So it's great to be here. I love that I've learned about the patches, and thank you, Marci, so much for having me here today.
Wow. I did not know that you are literally a family of doctors.
Sort of special, yeah.
It's very special. Doctors giving birth to doctors. Yes, literally both directions.
Yes.
Wow. Well, you never shared that story. That is that's a pretty special story. So
Yeah.
now, doctor, that you are in San Clemente as a regenerative doctor, an integrative doctor, how did you learn about LifeWave, particularly this stem cell activation patch, and why are you using it for yourself and in clinic for your patients?
Well, I learned about it through a patient of mine. I treat mostly patients that have chronic diseases that, seem to be difficult to manage and certainly get rid of. I have multiple sclerosis of the symptoms. I don't make that my identity, but because of all of that, I feel like I'm able to help people more and understand where they're coming from when they have long-term things, even though they're trying to live as healthy and great as possible. So I listened to one of my patients one day who was actually doing better despite many things we had been doing. And she was attributing some pain improvement for herself through a patch. And so she introduced me to X39 and LifeWave, and my ears perked up because I have pain at night. And I thought, wow, I like this idea, but it sounds absolutely almost charlatan. It's, too good to be true. And so I began diligently to do the research behind it and listen to David Schmidt's many, many webinars and look at the research. And I became convinced that it was going to be very safe and perhaps it might help me. And so I reached out and began using that. And that was back last May. So I haven't even been doing this a year now.
Wow. And so let's talk about what this is that doctors using. This is from the company LifeWave. It is the X39, and it is stem cell activation wearable light technology. Let's say that one more time. Stem cell activation wearable light technology. That seems like a lot to say, right? And then when you look at it, you realize how simple it is. Yes, it looks like a Band-Aid. It actually goes on like a Band-Aid. Look at this. It's sticky. And inside is white organic material. And that is organic crystal. And it turns out that we radiate a low-grade infrared light. And when you put this patch on your skin, it reflects your own light and activates a peptide in your body called GHK copper peptide. That peptide acts like a telephone to your dormant stem cells and says to them to start working again and start working like they are young again. Can you imagine? Start working again and start working like you're young again. Who doesn't want to be young again? I mean, I do. I would love to be. I thank you, Ann. Thank you for being with me on that. Who doesn't want to be young? I'd like actually the knowledge of my age, but I would love the skin of 20. Let's just be honest, right? So that's what this is. And it uses a technology, a light technology. This is a big word, but you doctors will know it, called photobiomodulation, light making change in your body. So this patch, through light, activates your body. This particular patch activates a peptide called GHK copper peptide, which in turn communicates, because our body communicates, pretty amazing really, to your stem cell army to start working again. Because you see, by the time you're 60, pretty much your whole army's on vacation. They're not dead, they're dormant. They're just sitting around doing nothing because nobody's communicating to them anymore to start working. So Dr. Patty, I gave that as a very basic description. Can you explain a little bit about what GHK copper peptide really is, and a little bit about how stem cells really do act as honing birds? Like, give us a little more meat on this subject.
Sure. Well, I got into injectable peptides through regenerative medicine several years ago, and also stem cells. And so I had done so much research a number of years ago about this. And one of my favorite injectables for myself and for my patients that we were using was GHK copper. And that's one thing that when I heard the patches actually stimulate GHK copper and stem cells in our body, I was so interested because that was my big area of interest. And what I've learned about GHK copper, it's just a short chain of amino acids. That's what a peptide is. And it literally is something we have in our body, just like stem cells, but over time and with stress and with aging and with illness, those diminish greatly in our body, our stem cells and our peptides. In particular, now we're talking about GHK copper. And so any way that we can help to build that up in our body, better. So I was using actual stem cells and actually using GHK copper injectables. When I heard that we could activate this naturally in our body through the patch, I became so excited because many people don't want to use injectables and they're much more expensive, and stem cell IVs and injections are very expensive. And the patch is an amazing way that we could keep this going in our bodies every day. So basically, GHK copper is going to help us sleep better, have less pain. Our cognition can certainly be better, and energy levels. And that's what we're looking at for most of us in our bodies for rejuvenation and for quality of life.
So explain, so tell me if you think I have this right. So stem cells are the only cells in our body that are changeable, which means they can change into whatever cell your body needs for repair. And this is why we look the way we looked when we were 20. Our stem cells were working at 100%. They don't start to really go down to 50% until you're 30. And then they go down again by almost 100% by the time you're 60. So it kind of makes sense. I mean, just think about your own life. When you were 20, like, you had no wrinkles, you had no gray hair. I had the unibrow. I don't know how many women had the unibrow. I wish I had it still. And like, the chronic diseases weren't really happening because your body was repairing. So then fast forward, think of yourself now. I'm 55. I don't know how old you guys are all, but put that. Remember what happened at 30, at 40, at 50. God, 50 for me was stage 3 breast cancer. Oops, the chronic disease came. Stem cells weren't repairing. I mean, that's just truth. That what was happening. So what if, doctor, by wearing this patch, we could activate those stem cells to start repairing our body again, like it did when we were young? Is it even possible, doctor? Is this true? It almost sounds science fiction to me.
Well, it does. And stem cells, there are different types of stem cells. And so the stem cells that we look at are mesenchymal stem cells. Those are the stem cells that we have as adults. They're different than the kind of stem cells that certainly are what helps to create the embryo. A stem cell at that level can, make an eye or an ear. We don't have that ability in our body, obviously, which is good, right? But the stem cells are regenerative, very regenerative in our bodies. And so they travel like little honing birds to areas of our body of greatest inflammation. And so that's why we want to work all we can to reduce inflammation so that the stem cells that we are activating can work the best in our body. And so those stem cells can be very rejuvenative. So maybe they'll travel to a joint and can help rejuvenate more cartilage in the knee itself. Maybe we can have enough regeneration that even hearing can be restored for people that may have some autoimmune issues going on, help with our heart, and many of our organs can be restored in certain ways. There's limitations with mesenchymal stem cells, but there's a lot that can happen regeneratively in our body. And so initially when we start the patches, we're doing the repair. And so some people will feel something immediately, pain. The first day I had a greater sense of well-being and less pain. And that night I slept better than I had slept in years. And some people don't have it that quickly. And I tell my patients, you need to be on these patches for every decade of your life, a month for each decade, and give it time. And that's our reparative stage, so that then we can remove into rejuvenative stages a little bit later, after we've been doing this for several months.
Oh, I like that. Hold on. I just learned something. There's a reparative stage and a rejuvenative stage.
Mhm.
Explain those one more time slowly for people like me.
So let's say you're 50 years old, and you would have then about 5 months, 1 month for every decade of your life. David Schmidt has talked about this, and what he says is that during that time, we're really doing a lot of repair. So you may not feel that your fatty liver is improving, right? But it's important to keep using these patches, because there is a reparative stage, meaning that the stem cells are going to your areas of greatest inflammation. Now, they're going to have reparative stages throughout your life, but initially there's much to repair, right? We want to get our bodies in order, get the inflammation down. And once then the stem cells have done that work, they can begin to be more rejuvenative. And even in those first few months, there's some rejuvenation there that you feel. But the longer I've been on the patches, the longer I've seen that, I'm finding more and more now rejuvenation, more and more energy, better sleep. It just keeps gradually
How about better
increasing.
skin?
Yes, yes.
I can't believe I've been now on
Mhm.
X39 for 3 years. And trust me, I had a lot of repair. I'm just saying, now I understand. I had
Yes.
a lot of repair. Shoot, for the first 2 days, the taste of chemo metal came out of my mouth. That would be my guess, repair. Ugh, what a bad repair. But now it's like my skin is so soft. My chin is tight. I mean, I'm 55 with tight skin, and I don't have turkey neck. I think that come on, ladies, we don't want turkey neck. Let's be honest what that is. Okay. So I think that's the regeneration now that I'm feeling that you're talking about. Is that right? Oh, you're muted. Did we lose?
Yes.
Okay.
Yes. That's all right. I mute because I've got some background noise.
We
in
do not
between.
hear it, doctor. We
Okay.
know. We're
Okay.
good.
Good.
So that's the rejuvenative. I have a hard time pronouncing that, but the rejuvenative stage that you're talking about, that's where we get eventually. We basically start looking younger after we repair all the old stuff in us. Is that right?
Yes, because then our body has the energy to do so. As long as our body is having to deal with just like putting out one fire after the other, and the stem cells are, okay, where do we go now? Kind of thing. But if we're eating a good, healthy diet, so we're not constantly re-aggravating our gut and inflaming it, if we're exercising our body as best we can, whether that means, if you're confined to a chair, you're doing isometrics, or you're walking or running or whatever your body allows you to do, and you're always challenging it. And then you're de-stressing, in ways through prayer and devotion and reading and sacred, books and words, and really trying to stay. I happen to be a Christian myself, and I have my Christian practices every morning, and that's so important to help us learn to de-stress and deal with life. And so all of it together is what then gives our stem cells a chance to really work and rejuvenate, and they're not constantly having to put out fires because we're drinking too much alcohol, or we didn't get out of the TV chair all day. So it's really important lifestyle, as David Schmidt talks about, and that helps to activate the patches. And just, I love that word too, rejuvenate. It makes you feel rejuvenated, right? Just to say it.
I'll tell you, the 4 things I'm really working on for rejuvenation right now is working out 4 days a week. That's new for me. I'm so proud of myself. Drinking really good water. I started drinking pristine hydro. It's right next to my mother's market in California. It's really good water. Yeah. And of course, my stem cell patches. And I'm really doing my best to push sugar out and go more, more non-inflammatory foods. And I'm really proud of myself, because I think it was the stem cells that kind of put me to the place of reevaluating, like, what do I really want for me? You know what I mean? Like, what does my body really want for me?
Yes.
And so anyway, so I have some questions in chat. People want to know the difference between, okay, write this down so you can add all, know these. PRP, bone marrow stem cells, cord blood stem cells, and stem cells called give me a minute, I'm looking at chat,
Exosomes.
exosomes. Of course you know what that is. Okay, so what are all those? And how is the X39 stem cell activation patch different from those four?
Well, the X39 patch is going to stimulate what we call mesenchymal stem cells in our body. And those are our adult stem cells, like I said, that can't make a new head or an eye, but they have some regenerative properties. And the stem cells actually just exude all these wonderful healing chemicals as well, okay?
Can you, Dr. Patty, put in chat? People want to know how that is spelled. I think people want to research this I can't pronounce it.
Mesenchymal. Let me see. Yeah. Okay. There it is. And many of us have heard of embryonic stem cells. We know that's illegal. We don't use embryonic stem cells in the United States, never have. That's the very beginning of how God put it within us to begin to make a baby. All right. And so those stem cells can make many things. So it's sort of like a tree. You start up here with embryonic and then it moves down. And then we go into, there's multipotent and pluripotent stem cells. They can do some things, but not as much as embryonic, but more than mesenchymal. And then you get to mesenchymal stem cells, which is what we're talking about today. Exosomes are something that is very popular now and being used by some regenerative doctors. And my feeling on that is, so exosomes are a part of the whole matrix of stem cells, but I don't like to isolate exosomes because I think that that God made, literally, this is nature, right? For everything to be in harmony together. And so often to pull something out and then really stick it into people. I've done a lot of research on exosomes and I do not support using them by themselves. I think they have the potential to be very good, but I think there's also the potential maybe for some harm to go awry because they don't have some of the other matrix to keep them in check. Wow. So we're looking at mesenchymal stem cells in particular. And yeah, feel free to sort of look at it, research, and our bodies are amazing. What they can do, how they can regenerate our brain, our body. Very, very amazing.
Wow. So the education, there's embryonic, which is illegal. There is,
except for they do a little bit of that sometimes in research and in some other countries as well. But for anybody's use,
illegal. Cord blood is not embryonic, but that is another way you can get stem cells. But that's from after having a baby, the blood of the mother's cord. That also is not legal in the US anymore, but it is legal in other countries. Then we have bone marrow, where you get your own stem cells from bone marrow. Although those, if they're not activated, are probably pretty old, if you're old. And then we have PRP, where they take the plasma, platelet-rich plasma, and they pull that out, spin it, and put it back in. That's your own. So there are. It sounds to me like there's different kinds, and X39 is different than all of these in that you're not putting somebody else's DNA in you. You, through light, are activating your own stem cells, and it sounds like they are the mesenchymal stem cells. Did I get that right?
Yes, and now women can still donate their own cord blood from their baby's birth to cord banks, but we're no longer allowed to use any stem cells from that. The cord banks can't distribute it to other people, and that's not allowed in the United States anymore. But I did want to say one thing about platelet-rich plasma, PRP. So it has a lot of growth factors and can be very effective. But these activating our stem cells and our peptides is just such a much higher plane of growth factors and regenerative factors that it makes sense to, go to the highest way we can regenerate. And again, there's no needles, we're not having to go through procedures. We're not having to pay a lot of money. We're just literally peeling off, 2 little pieces and sticking something on a patch on our body for the day. So to me, it's just amazing. And I always, as a practitioner, look for what is safe and what's going to be effective. We call it efficacious in medicine. And so something that's safe and efficacious, that's what we want. And when the FDA starts their trials, first they do safety. And if they then feel like it's safe, then they move into, is it going to actually be effective? And so we know through the studies and research that's done on stem cells and GHK that those are amazing substances that the body makes naturally. And we have our research that the patch activates stem cells and X39. So it's just, to me, it's a no-brainer. It's something everybody, can do for themselves.
Well, I'll tell you, if you go to startx39now.com, you can go to research and patents, and you can see that X39 has a 20-year patent. And if you read the patent, it says X39 activates GHK in the blood, which stimulates stem cells. It's right in the patent. You can't get a patent if the technology doesn't do what it says. So I love that David Schmidt, the owner, inventor, and CEO of this company, has 100 research studies and 100 patents on technology. He loves to invent, and he researches what he invents. And I really appreciate you, Dr. Patty, because you really do a good job, because she's in regenerative medicine. Dr. Patty literally has given GHK copper peptide injections 30 days in people's stomachs. She literally has done nasal stem cells for people. So she really understands the category of GHK and stem cells, and that she just went through with us the different types of stem cells and the different ways to get them. The one thing she didn't say is cost. Just so you know, PRP is $2,000. Tony Robbins went to Mexico for cord blood stem cells for $20,000 for an injection, right? So I just want you to see the cost. And so Dr. Patty is so forward thinking. When her patient brought in X39 and said that this could activate stem cells, she didn't go, oh, that's crazy, and not look at it. She said, interesting. And she went and did her research. And now she's wearing the patches, she's sharing the patches, because for literally $100 for a 30-day supply. That's less than a cup of coffee a day to activate your stem cells, non-invasively. Let's talk a little bit about that. What does non-invasively mean?
Well,
and non-transdermal. Those are 2 words everybody says. Is this non-invasive? Is this non-transdermal? Is this organic? These are questions that people, is this vegan? These are questions that people want to know.
yeah, and it's good that we can say, yes, pretty much to everything, because this is activating our body's own innate healing ability. And because we just live in such a toxic world, we do need to take some supplements, and we do need to eat healthy, and we do need, in my opinion, to use regenerative techniques. But a transdermal patch has medicine, a drug in it, right? That comes directly into your bloodstream. Sometimes that's important and needed for a patient. But we're not putting any drugs. There's no drugs, there's no chemicals. There's just these little crystals that are sort of cut in different shapes, sugar amino acids. And that's what the center of our patch is right there. And that is what our body puts out, infrared light. And we know that's a healing frequency. We see that with infrared beds, infrared wands. Our physical therapists use infrared light. Chiropractors often use infrared light, acupuncturists, and many of you may have that in your own clinic. But our body naturally has this healing ability of infrared light, and it just gradually sort of exudes from our body out. And when we put that patch on, we block just that specific energy point in our body to deflect that infrared light back into our body, to activate more the pathway for peptides and for stem cells. So it's such a natural way of working.
Wow. I just love the way you educate us. Don't you guys all feel like you know a lot more about this category called stem cells because of Dr. Patty? I didn't understand. So, and that this is medicine that is the forefront, and we have a technology that activates it for people. And it can literally, for less than a cup of coffee, start the reparative process. What did she say? Repair, moving into regeneration. I mean, it's amazing how many people we can help with this technology. Yes. Let's talk about how we wear this, Dr. Patty. How do people wear this patch?
So for the X39 patch, the two places in our body that have been studied through David Schmidt's research specifically are on the back of the neck, on that prominent bone that sticks out on the back of your neck, or 2 finger widths below your belly button. And that's sort of the midline of the body, and that's a really strong energy point. Now, if some of you heard him speak at Nova over the weekend, it was such a wonderful thing. I encourage you, if you can get a hold of that. Those of you that weren't able to attend and had paid to do so, I think you can get that for 30 days. I was so good. And then yesterday he had another product. He was talking about X39 and Eon in particular, but he also talked quite a bit about glutathione. He says, you know, if you've got a pain, you could put it here. And I've heard people's testimonies where they have a pain with their wrist. My testimony right now is I have a pain with my wrist. This is, oh my goodness, it's helping it so much. So I'm now wearing X39 on my wrist because that's where the pain is. And it goes throughout the whole body. But sometimes if you've got a specific area that you know is inflamed or painful, putting it there might give it just a little bit more energy, is what he says. But that's the way we start with X39. And all of the patches online and also with the little booklet you get with them show you places that you can put the patch to.
So let's just talk about that. So you could put the patch right below the back of your neck, underneath your belly button, 12 hours on to activate and repair, and 12 hours off. The reason you need time off is because we are non-invasive, non-transdermal. Look at, I just popped my spot. I popped both spots because this wrist has been hurting. That's pretty funny. Anyway, what was I going to say? So because it's non-transdermal and non-invasive and it activates us through a light signal, you've got to take time off of the signal or your body will get used to the signal and it won't work so well. So once again, below the back of the neck, underneath the body, as Dr. Patty says, our whole body is light. So any spot will do. And perhaps you want to pop the spot of pain, or pop the spot of irritation, or maybe a better way to say it, pop the spot that needs a little extra love. And like for me, I broke my wrist and I've been working out. So it's rehabilitating, but it hurts. So I just did what Patty said, right when she said, I just put an X39 and a glutathione right here. And I'm like, ooh, good idea. So it's your body. You know what I mean? Like, work with it. Your body will tell you a lot if you listen. So that is how that works. And know that every patch has its own 12-hour clock. And you can wear more than one. Okay, I have an X39 on this hand and one on this hand. You don't have to wear more than one, but it's okay. You can actually wear your patches together. Right now, I have X39 and glutathione on for today. Tonight, when I go to bed, I'm going to take those off. And when I go to bed tonight, I know I'm putting on an Eon and a carnosine because that's what I've decided tonight I want to sleep in. So, and then when I wake up in the morning, I'll take those off. So do you see what I mean? Like the clock, you have a 12-hour clock and any spot will do. You can wear more than one patch. My son, who has symptoms of OCD, he always he has a lot of brain spin, right? And so he's 24 and he just needs to be compliant. Do you understand? So he robs my box of patches every night and he throws them all on his forehead. X39 Eon Glutathione, for sure, always those. He goes to bed at night. He wakes up in the morning and he says his head doesn't spin in the morning. Like mornings are his best time. And I think it's because all night he's repairing with the patches. And I don't tell him to put his patches on. And anybody that has kids that like kind of like are on the spectrum of things know that when they do it themselves, it's because they see a difference, right? It's pretty interesting. So anyway, so doctor, now that we've understood our stem cell technology and understand that this is the workhorse of the line for LifeWave, this is always your beginning patch. But Dr. Patty loves to go to and you can write this down, practitioners, so you know where to research, just like Patty does. StartX39now.com. There is a tab called Patents and Studies. She always goes there to research. She also goes to the GHK link to research, which is on that site. There's also 2 great videos on that site. Well, actually 3. One on, it's just 3 minutes, the second video on stem cells, how they work in our product. Down below is David Schmidt, our owner, and he does an 18-minute video on how this technology works and the issues it helps with. And then further down for the doctors is another video where David talks to practitioners, and he really goes over the research. And then at the very bottom of the site, there's a tab that says connect to YouTube LifeWave Health. And you can just go to YouTube and type YouTube search LifeWave Health. Kathy, can you put that in chat for me? And what Dr. Patty does is she just then, when she gets there, that's the LifeWave YouTube channel. She just searches David Schmidt and whatever technology she wants to do a deep dive in. David Schmidt X39, David Schmidt Glutathione, David Schmidt Nirvana. And some of the best ones are the ones that are created by LifeWave Connect. And Kathy, I don't know if you got all that, but maybe you could kind of outline that so the doctors could edit, copy, edit, paste. Because I know as practitioners, you're going to want to do a deep dive like Dr. Patty. When I first met Dr. Patty, she's like, I'm listening to all of David's videos on every single technology because he does 1 hour on at least on every technology he has created. The man is not afraid to educate us, which is great. So Dr. Patty, why don't you now take us through the deep dive of glutathione? Oops, I'm so excited that it fell out of my hands. What is glutathione?
So we often call glutathione the master antioxidant. And I was thinking about a way to sort of explain it to myself and to my patients. And basically what we mean by an antioxidant is something that takes an oxidant out of our body. It's anti the oxidant, right? So an oxidant is something that our body produces, and it's actually a good thing initially. For example, an oxidant can take down a virus, all right? An oxidant can help our bodies to remove things that need to be removed. It can send signals to our inflammatory cells to go to certain places in our body that need help. But an oxidant is very unstable molecule in the body. And so what happens if it lingers too long, if it takes out the virus, great. But if it's staying in your body for weeks and months, it's going to take out a lot of good stuff with it because it's an unstable molecule and it just binds to this and grabs this like a little Pac-Man. And so what we want to do is use that oxidant when we need it for short bursts of time. But then we want to be able to remove it from our body as quickly as possible when it's no longer needed for something acute. And glutathione will latch on to that unstable oxidant that's running around causing trouble in our body, aging us basically, causing disease, and pull it out. And so that's why we call glutathione sort of the master antioxidant, because it's all over the body. It works all over the body. It can latch on to things that need to be latched onto to get out the debris, to get out the toxins in our body, to help prevent us from getting ill. And it also will latch on to some good things and activate them better in the body, like vitamin C or vitamin D. And so that's why we call it just the master antioxidant. It does so much for our body to help us detox and be healthy.
Wow. So, and glutathione, this is a pathway in our body, right? Like we have, it's not like an apple or something. It is, glutathione is a pathway in our body that's always going after oxidants or these free radicals that are not stable. Am I understanding that right?
So glutathione is a molecule. It's actually an amino acid as well.
Oh,
It works through, you're correct, it works through a glutathione pathway in the body. And so that chain of reactions then allows it to latch on, become active, and pull things out of the body. I've had some genetic testing done on myself, and my glutathione pathway, and there may be multiple ones, but the main glutathione pathway that we check doesn't work very efficiently. And I've never been able to take glutathione as a pill, because it would make me very weak and my muscles would just get very flaccid. And so I was getting a double whammy. I wasn't able to do much with the little bit of glutathione I still had in my body, and yet I couldn't bring more in. So that's the beauty of the patch, is that you can use it a little more slowly if you need to, but it will begin to optimize your glutathione pathway in the body so that you're utilizing glutathione in the proper way.
okay. I have two questions on that. First question is glutathione, what's the difference between an amino acid and a peptide? And I know we say GHK, which is the X39 patch, is a peptide. Is glutathione another peptide too? Are they different? I mean, you know what I mean? Are they in the same category but do different things, or are they different categories?
Yes, so amino acids are one thing, like let's say glycine would be a good example of an amino acid. And that is the G and GHK copper. And a peptide is a short chain, a combination. In this case, glutathione has 3 amino acids. Cysteine is another one that it has as a part of it. And GHK has 3
amino acids. So
amino acids, and that's what a peptide is, just a short chain of amino acids.
Oh my God, who knew that? I didn't know that. A peptide is a short chain of amino acids. So glutathione has 3 and GHK have 3, but they have 3 different amino acids, and that's a short chain peptide. Did I get that right?
That's right. And the combinations are different. So they may have, maybe one would be the same, but then the others are different. So every peptide has a specific combination of amino acids, but it can't be a lot. It's just a very short chain of amino acids, and often it is 2 or 3, maybe 4 at the most.
Wow, so it sounds like these amino acids that move into peptides are the it thing. If we got a GHK that's so powerful and a glutathione that's so powerful, doing different things, GHK is activating stem cells. It seems like glutathione is going after the oxidants. So we got, okay, I just have to put this together. So when I wear X39 and glutathione, X39 is activating my stem cells for repair, and glutathione's going after all the oxidants, all the unstable stuff that's attacking me. So I'm kind of getting double protection in different ways.
Yes, we are. And all of these pathways in our body are there for a reason. And if one of them's not working, it's sort of trying to run the race of life with, like a 3-legged race where you've got 2 tied together with a leg tied together with somebody else. And so we want to have all of our pathways activated, especially our detox pathways, because we are exposed to a lot of environmental chemicals and things that just aren't optimal. And that's why it's important for us to drink clean water, like you were saying, Marci, and to eat organic food as much as possible, trying to avoid pesticides and eating clean and healthy. And the more clean and healthy we eat, the more some amino acids are essential to our bodies, and some of them we can really get through our food. So we need to make sure we're always eating that way, so that we're not just depending on the glutathione patch to detox us. We want to prevent toxins from coming in as much as possible by our healthy, clean lifestyle. But then what we get there, then it needs to be removed. So both things are important.
And I have two questions on that too. But the first one is, we know that glutathione is a short chain amino acid that detoxes us. I just learned that today, by the way. And it moves through a pathway. Does GHK, is that a pathway too?
It is. It is. All of them are, these pathways that we talk about. We have to have the raw material to activate the pathway to get it going. And so the more our body has to wait around to get the, material to start, the more, impaired we are and the less healthy we are. So we want to always have more stem cells at our command in case we do get exposed to something or get ill or whatever. We want to have more peptides at our command as well.
Wow. Okay. So then my next question is, you say we need our glutathione pathway, which detox, to work. What do you mean to detox? I understand that it gets rid of the oxidant, so it grabs those little free radicals, but so let's just be honest. Like, I got bacteria, fungus, virus, mold. I just, there's heavy metals, there's Roundup everywhere. Gosh, I met a lady that they just tested Roundup and found it in school lunches. I mean, I just a little bit scary, honestly, the toxins that are going in our body that we don't even fully know about, Patty. Like, explain what that means, and how does glutathione help protect us from that?
Well, it does, because that's one reason we call it the master antioxidant, because it's able to latch on. And so everything that we have in our body is constantly being broken down and built up, like bone, for example, like cells. It's constantly changing, right? Our skin's constantly changing. And so that produces some cell debris that has to be removed in order for more rejuvenation to occur. So we want to get rid of cell debris. We want to get rid of any toxins that we have unknowingly maybe brought in. We're eating all organic, but maybe that farm is next to a farm that's not organic, and the wind blows some of the glyphosate or pesticide over into our food. And so we want to be able to get rid of other things. So glutathione is great to detox for heavy metal, for any major toxins. It helps to protect us from viruses and other, like you said, bacteria, anything that might get a little out of hand in our body that needs to be pulled back. And so it can just go after that through a process where it attaches to that debris, that heavy metal, that virus, and inactivates it. And then through that pathway, ultimately pulls it out through the body, and we either pee or poop it out.
Whoa. I just got it. I just finally got the process. Okay, so you got this virus running around, you got this metal running around, you got this Roundup running around in your body, and it's a toxin. And glutathione comes up and attaches to it and says, we're gonna put the fire out. That's going bye-bye. And then it takes it down and eliminates it through pooping or peeping. Did I just get that?
Yes, the most of the time that's correct. Sometimes we can eliminate through sweating. And there are some other ways that we can eliminate through our body, but most of it's done through poop for the most part.
Through poop. So we really do need to have good, consistent bowel movements, because that's where the toxin's coming out. Is that right?
Yeah, and David Schmidt mentioned that too. I believe it's something I was listening to recently, and maybe these last few days he's been. I've listened to him quite a bit between Nova and yesterday, but the idea that your doctor could say, "Oh, it's okay if you're just pooping every second or third day." It's really not, because you're not getting the toxins out. They're just staying, and you want to have that constant ability so you can remove them as quickly as possible from your body. So it's really important to have good elimination, which goes back to good eating, right? Habits and exercise.
Yes.
And plenty of water. Water is important. We know we have to have that.
Somebody said, and this is not really a water conversation, but somebody said, is alkaline water home filtration a good choice? I'm not sure what water system that is, but maybe you can give us 2 minutes on water.
So alkaline is good, yes. And what happens is, in our Western world, in our Western diet, we're always eating more of an acidic diet if we're eating fast food and we're eating packaged food and junk food and so on. And our body then gets very acidic, and that is disease producing in our body, which leads to things like type 2 diabetes and high blood pressure and coronary artery disease and et cetera, et cetera. And so what we want to do is alkalize our body. Alkaline water is helpful. Fruits and vegetables help to alkalize our body. Red meats and packaged foods help to make it more acidic. So we want to try to eliminate, or at least greatly decrease, those things, and eat more fruits, vegetables, and drink good water. And so there are many different kinds of processes of water. There's even structured water. David has talked about that. It's a whole different concept and idea. If you want to really wrap your head around something interesting, look up structured water. And it may be even more amazing than, all the water purification systems. But yeah, so
structured water. Well, I'm going to go talk to my water guy today and ask if his water is structured. I don't know.
He probably doesn't know about that, and because it's sort of on a different plane. It's an energy type water. Very interesting. Yeah.
Energy type water. Well, we all look forward to learning more about clean, filtered, structured water. Filtered, structured water. Okay, I have another question for you. I've had some moms talk to me lately about themselves and their children with this glutathione pathway that doesn't work. And I'm sorry, I can't exact MFT something or other. What are they talking about? What is that? Do you know what that is? And how does they say it doesn't even matter if they take glutathione because their pathway doesn't work. And can I tell them when we take the X39 glutathione that we can get that working or help repair it? I don't know how to answer that. And it seems like a lot of special need kids have this pathway that's not working. Do you know what I'm talking about?
And they might be talking about MTHFR. I'm not sure.
Yeah, they are.
MTHFR.
Can you say that one more time slowly?
Yeah, so it's MTHFR. It's what we call methyl tetrahydrofolate. Reductase doesn't work so well in our body. All that means there's about 25% of us probably that have that pathway. We're not as able to do what we call methylate, which means we attach a methyl group, that's a group, a chemical group, onto things to detox, and it pulls it out. If you don't methylate very well, you're not going to detox as well. Now, everybody has the ability to detox some. That's one reason why my glutathione pathway doesn't work well, because I also have the methylation issue. That's why you should always take methylated folate and methylcobalamin, folate and B12, if you have that issue. I just give it to all my patients because probably most of us that have chronic situations probably are methylator, we don't methylate too well. And so that's probably what they're talking about. And so what
Dr. Patty, can you at some point write those 3 things in chat? I know you're talking, but at some point we would love to know those 3 in chat.
Sure,
okay.
sure. But the glutathione patch, it's going to activate help your own pathway to work better, to take glutathione, and we all have some of that. I mean, maybe there would be some person that genetically was so impaired that they basically couldn't live, because we all have some of it, but we just need more optimal. And so that's why the patch overcomes that and helps to gradually upregulate that pathway in our body, because it's not giving us glutathione that we don't know what to do with because we can't methylate, right?
Okay, no, explain that one more time. It's because it's not giving us glutathione that we don't know how to deal with, and we can't methylate it. So IV glutathione, pill glutathione, liposomal glutathione, how does that work different for an MTHFR person that doesn't methylate well versus our patch that activates your own glutathione for 12 hours? Why, what, I don't understand. Like, why does one work in that, one is okay for MTHFRs and one not so good?
So glutathione itself, if your body doesn't know how to bring it into the cell, it's not going to be helpful. So we've got to have a pathway to take that glutathione and bring it into our cell. And that's where it becomes activated and works for us. So when you're taking in glutathione externally, like I tried to do for years, what happens is it hangs out in the bloodstream, and all you get is side effects from the glutathione. You can get a rash, you can get a headache, you can get very sick and nauseated from those glutathione pushes. And I'm seeing it happening more and more because you just can't take it in fast enough, and it hangs out in the blood and makes you sick. When we activate our own and do it gently, so that we are doing what we call up-regulate the cell receptors. What that means is our cells have gone, we don't know what to do with glutathione, we're not taking it in. But as we begin to gently activate that that glutathione pathway in our body through the light of healing and infrared light healing frequency, as we do that, that's the natural way, then we actually benefit, and our body cells produce new receptors. They bring the glutathione out of the bloodstream where it can cause side effects and gently into our body. But we have no glutathione hanging out in our bloodstream right now that we're taking in for the patch, because there's no drugs. So it doesn't cause that problem.
Is that because the light is activating just as much glutathione as those receptors can take in, because light in our bodies, I guess you could go back to biblical times now, they're meant to be together. And so you basically then slowly, that glutathione from the patch will tell those receptors, it's okay, open up a little bit. I just got a little right now. And then it will give a little more. And where when you do a push, it's just external glutathione that cell can't handle. And I'll tell, I think in a moment, I just want to make sure I'm right about that, but I'll tell you on glutathione, we call glutathione no joke, where the X39 is the workhorse of the line. Glutathione is super powerful, especially for the MTHFR people who maybe take 25 to 50% of the folks that can't methylate as fast. So no, with glutathione, you can upregulate yourself, titrate yourself up, just wear a half of a patch for a couple hours one day. And then the next day, wear the other half of a patch. Dr. Patty is one of those people that has a pathway that doesn't methylate very well. How did you start yourself up with glutathione?
Right. And the reason we have to start that glutathione patch slowly, and I'm so glad you asked that, because I did want to make sure this is clear, is because it's causing our body to detox. So if we're not detoxing well before this, we've got a lot of stuff in our body that needs to come out. And so if all of a sudden we're just hitting it and it's all coming out, then we can get a headache or a rash or feel fatigue or not feel good, right? And so we want to gradually allow that detox to happen. And that's why if you're sensitive, or for any of my patients, I do what Marci just said. We just take off one side, one half of the patch, and then you just wear that maybe even an hour or two, and make sure you're really hydrating. If you do start feeling a problem, and my lovely sponsor with LifeWave, Karen, told me about this because I was telling her some of the issues. And she said, yeah, you just put that on and maybe just wear it an hour that day. And then the next day you put it back on, wear it for 2 hours, and you gradually increase it. And I'm like the most super sensitive person ever. You know, if I just look at a vitamin, I have some reaction often. And so I thought, okay, I'm going to try this. And that's what I did. And it took me, I don't know, Karen might remember better than I do, but I'd say a month or two before I was wearing it 12 hours full patch. And now, you know, ever since then, it's been great.
So you have a pathway that doesn't methylate. So here's the doctor explaining methylation and the patient who doesn't methylate well. And she just said she titrated herself up with glutathione a little bit at a time, an hour at a time. And now, I mean, what's amazing is your testimonial that even someone with a pathway that may not be functioning correctly, you can still, with this product, methylate your, or titrate yourself up so you can fully methylate. I mean, that's pretty, that's a pretty big statement, doctor.
It is. And you don't ever like cut the patch in half, because that would destroy the mid part of it. You just take a little bit of the part off and then wear it for a period of time. You take it off of you. Let's say you wore it an hour that day and you put it just in a little glass jar, and then you can reuse it. And I've been able to reuse them pretty well for, you know, a period of time. Occasionally one may not want to stick, but for the most part, they work pretty well. And you can always use a little medical grade tape. Karen had told me if you need to, you know, if it's not sticking and you still have more left in it, you haven't used it for 12 hours.
Well, all I can tell you is I learned a lot today. I hope you all learned a lot. I think this practitioner call should just be Ask Dr. Patty, right? Because, okay, how many people here learned about amino acids, learned about peptides, learned about pathways, learned about oxidation, antioxidants, oxidants, and methylation? I mean, I feel like I'm educated. Kathy's educated. Wow. I'm always amazed at what we learn. Oh, we can ask Dr. Patty, and we understand every type of stem cell now and how they are injected in the world. Okay, so that's what this call is. Dr. Patty, I was wondering if you will be on next Thursday, and I would like a deep dive on X49.
Sure.
I love that we're picking one at a time to really understand. I hope you guys are all liking that. We will, of course, always speak X39 first and deep dive on one. And so that would be lovely. I'd like X49 for next week, and then the week after, Eon.
They're all good. Sure. Yeah,
Okay.
I like it. All right.
Okay.
Bless you guys. It's so good to see everybody today, and I hope you have a wonderful day.
Okay, thank you so much. Bye-bye, everyone. Have a great day.
Thank you. Bye-bye.